So good day everyone. So this MEDRES 1 lecture will tackle research questions and their transformation into appropriate research designs. So let's make use of the research question as our starting point here in this whole process. So once you have a research question in mind, the next appropriate thing to do would be to perform a review of related literature to see or to become more familiar with the background of your research question. Now, depending on what you will find in your RRL, you may sometimes need to refine, revise, or even replace your research question with a new one. And once everything is set, once you've been already well informed of the background of your research question, then you can now move on to designing your study. So a well-designed study is needed so that you could be able to test or answer your research question. And that would involve having an appropriate methodology, adequate sample size, and the right statistical plans that you will use to analyze your data. So once you've got all of that planned out, the next thing would be to go back to your review of related literature to see if everything is squared away. Was there anything else that you've missed? Maybe it might be, is it the appropriate study design that you're using or you're planning on using or not? You might also sometimes need to look at prior similar studies that are related to your research question so that you could be able to refine your design even further. So once that is all done and you've already obtained ethical approval and technical review of your proposal, you can now go ahead and collect your data. And once you've collected your data, you start processing and analyzing that data of yours. And from there, you can draw conclusions depending on the analysis that you will obtain, and then see to it. And basically, you go back full circle to see if the results that you got from your study and the conclusions that you derive from it would answer that original research question of yours or not. Okay, so in this video lecture, we will be using the same PCOM-PECOM format that you've already encountered in your previous MEDRES 1 lectures with Dr. Besa. So just pause this video to review the different components of this model. Now, you might wonder what inspires a research question. For one thing, it could be a lingering problem that doesn't appear to have any apparent or straightforward solution despite exhaustive literature review. Okay? So another thing that could inspire research question could be the burden of a particular illness. And the usual burning sub-questions here are there any cheaper alternatives in terms of treatment for this particular disease? Or are there better diagnostic tools or cheaper diagnostic tools that work just as fine as ones being used currently as standard of care for that matter? Okay. Now, it could also be inspired by any gap in knowledge. And with that, you'd often read as you go through your textbooks or journal articles for that matter, this particular phrase, which usually goes as such: it is still unclear if X is effective for Y, etc., or maybe any similar phrase for that matter. So that could also be one thing that could inspire a research question. Okay. Now, it could just be sheer curiosity as well. And very often, too, it could also be an unanswered question in your clinical practice. So you encounter a clinical quandary, and despite exhaustive literature review, you still don't have any answer to that particular question, then that is basically the start. Then there you have your research question for that matter. So bottom line, what it all goes down to with regards to research questions is that they pertain to the problem that your research is hoping to address. Okay. Now, what makes a research question a good one? Well, it should have at least some of the following characteristics. first, it should address a gap of knowledge, right? And it should be significant enough to contribute to the existing body of knowledge, meaning you're at the cutting edge when it comes to that particular field, you know? And of course, it's impossible a lot of times that you have all the answers in a single research study. So, for that matter, whichever you're working on should eventually lead to further research, right? And your study should also render the problem you're aiming to address to investigation through collection of data. And of course, whichever you're working on, it should be in their of interest to the researchers and they suit their skills, time, and resources. Of course, you wouldn't want to pursue something that is not worth your time unless you're paid a handsome amount. But still, you know. And lastly, the ethics aspect of things should not be overlooked. So the approach that you'll be taking towards solving the problem should be ethical and not trampling on any rights of the study participant. Now, we could also take this approach when we are trying to come up with a research question, and that approach being we go through the different basic research designs that you've already covered during the earlier part of this MEDRES 1 course, because their corresponding research questions each have a particular format, which we will see shortly with a few examples. So, for instance, if we want to determine the frequency and burden of a disease, usually in the form of a survey, uh, basically you do what's called a cross-sectional study. And in some instances, particularly if you're interested in disease incidence, then you do a cohort study which follows a group of patients prospectively. Now, if your study design, or rather, if your research question would like or aims to identify a particular risk factor for a given condition, for instance, then you have cohort studies and case control studies that you can use as your study design. Now, cohort studies can also tackle research questions that translate to objectives that determine the prognosis of a particular disease, for instance. Okay. Now, if we're trying to determine the efficacy or effectiveness of a new treatment, okay, then clinical trials are the way to go. Okay. Now, you also have what is called evaluation research, and this is very common in public health. So these particular researches evaluate any health programs to see if its objectives in improving public health have been met or not. Okay, so and naturally, research questions would be veered towards evaluating community programs. Now, research questions, particularly clinical research questions, can be narrowed down to four types, namely therapy, diagnosis, harm, and prognosis. Now, each type has a particular research design that is typically used to help answer the research question. Now, as you will see in a bit, using the PICOM-PECOM format, we will learn that the research question is formatted in a particular way for each type. Okay, so let's start off with therapy type research questions. So you'll see here in this slide a table wherein I made use of, or rather I enumerated the different components of the PICOM-PECOM model. Notice as well that the M part or the M component of the model is not here. There's a reason for that. I'll show you in a bit. Now, the P part of, or the P component of the model, when it comes to therapy type research questions, pertains to the patient population with a certain disease or condition. Now, between PICOM and PECOM, when it comes to therapy type research questions, we gravitate towards PICOM because we with therapy type research questions, we're aiming to evaluate a particular intervention, be it pharmacological or non pharmacological, to treat a certain condition which is present in the patient population that you want to study. So the I part here then would be intervention. Okay? So this pertains to the treatment or intervention to be given to these patients to address that certain disease or condition uh, that they have. Okay. Then of course we have to have a comparison. Okay. So that would be our C component of the PICO model. Okay. So that comparison could either be the current standard of treatment that is being used to address that or to treat that particular disease or condition, or if it is a novel condition wherein you don't have any standard of treatment yet, then we use placebo as the comparison. Okay, and we have the outcome that we're interested in, and the outcome or rather the intended outcome of the treatment really depends on the objectives of uh, this particular study. No, basically, what do you want to do with the disease or condition involved? Is this study aiming to cure, or is this study aiming to prevent, or is this to prevent a remission for that matter, or is this involving which treatment would result in more symptom relief or which treatment would result in longer survival? Okay, so those would be the different outcomes that you can include in your research question. Now let's look at the sample research question here. Okay, so for P, so P would be children 1 to 5 years of age. So among children 1 to 5 years of age, how effective is zinc supplementation? Zinc supplementation being the intervention being evaluated compared to placebo. So your comparator here is placebo in preventing acute diarrhea. Okay, so prevention has been chosen as the type of outcome for this particular research question. Okay, so among children 1 to 5 years of age, how effective is zinc supplementation compared to placebo in preventing acute diarrhea? Okay, so let's look at another example. Okay, now let's say the P component or the patient population component of your PICO model would be obese non-diabetic adults, and you want to see how effective subcutaneous injection of liraglutide would be compared to placebo in terms of reducing body weight by 10 to 15, rather 5 to 10%. Okay, so if you would format the research question following the PICOM model, we're still under therapy for that matter. Okay, so the research question would be like this. So among obese, non-diabetic adults, how effective is subcutaneous injection of liraglutide compared to placebo in reducing body weight by 5 to 10%? Okay. Okay, so as I mentioned earlier, the intervention does not necessarily have to be pharmacologic in nature. It could also be non-pharmacologic, intending to address something that may not necessarily be medical in nature, for that matter. In this particular example here, we're looking at medical education, okay, and then we're looking at the flipped classroom approach as the intervention, with comparator being traditional classroom lecture. Okay, so in this particular example, we chose first-year medical students of San Beda University College of Medicine as our patient population, or our population for that matter, the P component of your PCOM. Okay, and then our outcome being the numerical grade in anatomy. So if you would format the research question following the PICO model, it would be as such. Among first-year medical students of SBU College of Medicine, how does the use of flipped classroom compared to use of traditional classroom lectures affect their grade in anatomy? Okay. Okay, now for therapy type research questions, the usual methodology or the M component of the PCOM would be performing randomized controlled trials. Okay, so as a review, you basically have a population from which you draw a representative sample, okay? And then from the sample, you randomize the study participants to one of two interventions, for instance. Now, the number of interventions or the number of treatment arms do not necessarily have to be just two. It could be more than two as well. Really depends on the researcher's objectives. But to just keep things simple, let's just stick to two treatment arms, okay? So again, we have a study population to which we're aiming to generalize our results to. We draw a representative sample from that population, and then we randomize the study participants in that sample to receive either intervention 1 or intervention 2. And then we follow them over time, or we follow them prospectively to see if they attained the outcome of interest. And we want to compare if there are significant differences in the outcomes by the end of the study period. Okay, so basically the randomization process here is something that we employ. It's a requirement in our CTs because this is one way in which we equalize the characteristics of the study participants, which could either be measured or unmeasured, between the two treatment arms, so much so that the only difference that there is between the two treatment arms would be, or between the two groups for that matter, would be the type of intervention that was used. Okay. Okay, so let's move on now to diagnosis or diagnostics types of research questions. Okay. Now, the P component of the PCOM-PECOM model would pertain to the patient population with a particular clinical characteristic on whom tests might be done. Okay, and as opposed to therapy type research questions, we are not involving ourselves with any intervention, but rather with exposures. So we will be sticking to the PECOM model here instead of the PCOM model. Okay, so the exposure in this case would be a diagnostic method, usually an index. We usually call that an index test, or the test that we're trying to assess, whose accuracy or validity you want to evaluate against an established gold standard. And the gold standard naturally would be the comparator. Okay, now the outcome then would be, or rather the outcome pertains to the outcome or condition that the index test is supposed to diagnose. Okay, so let's look at one particular example here. Now, the P part of the PECOM model here will be among postmenopausal women presenting with a breast mass. Okay, how accurate is fine needle aspiration biopsy or FNAB compared to surgical biopsy? So the latter, with the latter, a surgeon makes an incision in the skin to access the suspicious area of cells, and obviously this is more invasive compared to fine needle biopsy. Okay, so we have a gold standard here that is clearly more invasive than the index test that we're evaluating. Okay, and as I mentioned earlier, when it comes to research questions, or rather, one of the things that inspire research questions would be looking at more acceptable alternatives to diagnostics. Okay, so in this case, having just a puncture obviously would be more preferred over an incision. Okay, that would be a few centimeters long, sometimes even longer. That would take several days to heal. Okay, so and what if this much less invasive procedure just yields the same results as the gold standard? If we're able to establish equivalence for that matter, then then maybe perhaps we can start changing the standard of care towards doing FNAB. Now, mind you, this is just an example, and using FNAB is already very much part of standard of care for several years already. Okay, Now, moving on with the research question, so the outcome here would then be establishing the presence or absence of breast cancer. So, breast cancer, whether or not there's breast cancer, that would be the outcome in this case. Okay, so just to read the sample research question, among postmenopausal women presenting with a breast mass, how accurate is FNAB compared to surgical biopsy in establishing the presence or absence of breast cancer? Okay, so here's another example here wherein we're dealing with dengue or dengue hemorrhagic fever. Now, in diagnostics types of research questions, the comparator is more often implied because everybody knows, or at least there is already an established standard of care or standard diagnostic standard that is being performed to aid in the diagnosis of dengue. So repeating it just becomes redundant, okay, unless it's not widely known in the medical community. But in the case of very common diseases such as dengue, it's pretty much common knowledge among doctors what the standard diagnostic tests are to aid in diagnosis of that particular disease entity. Okay, so you will with diagnostics type of clinical questions or research questions, the C or the comparator or the comparison component is very much or is very often implied. But for our purposes as MEDRES 1 students, we would still need to mention everything. Okay. Now, in this particular example, so we have here now the different components. Let me just read the entire question. So among children presenting with fever less than 72 hours, how accurate is the patient's age, platelet count, and WBC count compared to the composite tests of PCR for dengue virus RNA, IgM antibodies, or the NS1 antigen ELISA test in determining the probability of dengue? Okay? So in this particular case, we're testing a more or cheaper alternative. So we're using patient's age. We're using the composite of patient's age, platelet count, and WBC as a group of diagnostics, which are obviously cheaper than the ones being compared to. Okay, so we want to assess whether this particular composite is just as good as the standard tests being used to diagnose or to determine or to predict the probability of dengue. Okay. Okay, so now for another example that is perhaps less medical and more social in nature. Okay, so here you're interested in seeing whether a group of people's perception and attitude towards vaccines would predict or be diagnostic of whether or not they would have their children vaccinated against measles. Okay. And then it's really hard to pinpoint what the comparator or the gold standard is. And for that matter, we can have different types of perceptions and attitudes towards measles vaccines. And this is perhaps what we would like to assess. Okay, so in this case, the research question would be among parents residing in Barangay X, Municipality Y, how does their perception and attitude towards vaccines in general predict or affect non-vaccination of their children against measles? So if you could still remember from a few years back, there were issues about the Dengvaxia that brought about a lot of controversies, and this also induced or stirred up some vaccine hesitancy among a good percentage of our population. Okay. Okay. Now, very often with diagnostics, we perform case control studies, or the design would be of the case control design. Now, as a review, we start off with the outcome or the disease of interest, and we go back in time to see whether an exposure, or rather the exposure of interest, has occurred to these patients or not. And then we try to associate or see if the exposure of interest has association with or is causative of the disease or outcome of interest. Now, clearly, compared to cohort studies, there are limitations and caveats to the use of case control studies. Okay, you have certain sets of biases that are involved with case control studies that could be mitigated by just switching over to a cohort design. But now, if you could still remember from previous lectures, cohort studies occupy a higher position in the hierarchy of study designs compared to case control. But nonetheless, as long as the study is well designed or the details are well thought of or are well taken care of, then a case control design can be performed well with the least amount of bias as possible. Okay, so let's now move on to research questions of the prognosis type. Now, when we say prognosis, we are pertaining to the likely course of a disease or ailment or condition. Basically, we're trying to find out what are the chances of cure or survival. Is it favorable or not? Those types of things. Now, the P component of the PECOM model, so take note we'll be using the PECOM model here, okay, instead of the PICOM model, okay, since we're not doing any intervention or we're not performing or evaluating any intervention. Now, the P component of this model would pertain to the patient population with a particular clinical condition. And as far as exposure is concerned, the exposure pertains to the risk factors, or rather the important factors that affect prognosis or the likely course of a disease or condition. Okay? And the comparator would be what would be the outcome if you did not have these particular risk factors. So that would be the comparator. Okay? So exposure would be the presence of the risk factors or risk factors that put somebody at risk for unfavorable outcomes, and the comparator will be the absence of those factors. Okay, and the outcome really depends on the objectives or what the researchers want to find out. That could be the chances of death, chances of survival, chances of recurrence of the disease. Okay, now let's have an example here. Okay, so among diabetic patients, so that would be our P, right, in the PICOM model. So among diabetic patients who have proteinuria, okay, as opposed to those who do not have proteinuria, what are their chances of developing renal failure down the line? Okay, so we're trying to prognosticate here. What would be the more likely course of the disease if a particular diabetic patient has proteinuria as a risk factor we're trying to assess. Okay, hopefully that was clear. Okay, so let's have another example. So among elderly men with treatment-resistant metastatic cancer, okay, so that would be the P component of the PECOM model. So we have elderly men as a patient population, and the particular clinical condition that they have is treatment-resistant metastatic cancer. Okay, so among this particular group, who sustained pathologic fractures as opposed to those who did not sustain pathologic fractures, what is the risk of death or overall survival over the next 3 years? Okay, so as you'll eventually learn in your clinical years, having a sedentary state, which in the case of such patients we're looking at, it could be from pathologic fractures. It's usually associated with poorer outcomes. Okay, so in this case, for this particular group of patients, i.e., elderly men with treatment-resistant metastatic cancer, we want to assess having sustained pathologic fractures as a risk factor for the risk of death. Okay, so and we have the absence of pathologic fractures as a comparator. Okay, And again, just to reiterate, research questions may not necessarily always involve anything medical. So in this particular example, we're looking at medical education. Okay, so among first-year medical students at SBU College of Medicine, that would be the P component of the PECOM model. The risk factor is they only pass 50% of their anatomy long exams. So, and the comparator will be the absence of this particular risk factor being assessed. So, what would their chances be of failing the anatomy course at the end of the academic year if they passed only 50% of their long exams? Okay, so that's definitely one example of a prognosis type research question. Now, such types of research questions would need the cohort design in order to be answered. Okay. Now, if you could still remember, cohort design as opposed to RCTs do not have the component of randomization, and we are not involving any intervention with cohort designs. Because obviously, for ethical purposes, we're not going to randomize patients to factors or interventions that would increase their risk for poor outcomes, obviously. Okay, so we often make use of cohort designs wherein we just observe the presence or absence of risk factors, which may or may not be randomly distributed in a particular population, and then we follow them over time or prospectively to see what their disease course would be. Okay, so and that actually implies that we already have a certain set of outcomes that we're interested in that we would want to measure at the end of the observation period. Okay. Okay, so the last type would be the harm type of research questions. Now, in such cases, we want to assess whether a particular intervention or exposure does some harm or is harmful to a particular group of patients in the long run. Okay, so going by the PCOM-PECOM model, the P component of this model would pertain to that patient population at risk for a particular outcome, let's say. Okay? And the intervention exposure in such cases would be any potentially harmful treatment, agent, chemical, etc., to which a patient has been exposed to. And actually, we have to compare this to the absence of such exposure, or it could also be exposure to something else, presumably much less harmful, okay, than the one being assessed in terms of harm. Okay? Then the outcome would be the condition that the patient would develop down the line, or the harmful condition, or the condition that reflects harm of the exposure that such patients would develop down the line as a consequence of being exposed to such potentially harmful exposure intervention. Okay, so let's look at a sample question to make things hopefully clearer. Okay, so among healthy adults, how strongly associated is mobile phone use compared to absence of mobile phone use, okay, with the risk of developing brain cancer? So this was from, let's say, 20 years back when there was this controversy about cellular phones being implicated in brain cancers. So we have here a particular intervention or exposure, or more of an exposure really, which is the use of cell phones or mobile phones. And then we want to assess if this is harmful in terms of whether or not patients who are frequently exposed to this would develop brain cancer down the line. Okay, so again, it's very easy to confuse this with prognosis, but here it really looks at a potential harm that can come about by a particular intervention. So basically, this outcome is not the intention. Okay, it's just something that's observed. So sometimes we make use of randomized controlled trials with the objective of curing, but we're also looking at adverse effects or adverse events which is the harm part in RCTs. Okay, so it's unintentional. That's not the one that we're really aiming for, but it's something nonetheless that we have to observe and record. Okay. Now let's look at another example here. So among healthy adults, how associated is infection with Zika virus with the risk of developing Guillain-Barré syndrome? Okay, so the exposure here that we're assessing for harm is infection with the Zika virus, and of course, comparison would be not being exposed or not having the Zika virus infection. Okay, so and clearly we're not randomizing people to get infected intentionally with the Zika virus. So a lot of times this is all observational data that we review retrospectively. Okay, so the harm or the outcome that embodies harm here would be the occurrence of GBS or Guillain-Barré syndrome. Okay. Okay, so let's have an example that is medical education related. So among medical students, how associated is the amount of social media usage with the risk of failing major subjects? Okay, so the exposure here, whose harmful effects we're trying to assess, would be the usage of social media, with the comparator obviously being social media usage to a lesser amount. Because of course nowadays you really wouldn't see anyone not involved in social media. Okay, and the harm or the outcome that embodies harm here that we want to measure would be failure in major subjects. Okay. Now, when it comes to research questions pertaining to harm, the study designs involved don't necessarily just limit to one, but rather you can have RCTs, you can have cohort studies, you can have case control studies that address research questions pertaining to harm. But keep in mind that not that it does so not as the primary objective, okay? Because obviously, for ethical reasons, we do not randomize anyone or expose anyone to anything that would be potentially harmful. Okay, one very good example would be in RCTs, wherein we are assessing the benefit and efficacy of a certain medication, for instance. But it's unavoidable that these medications would have adverse events or side effects, and that's actually what we always would assess for, particularly the safety component of RCTs. We monitor for any adverse events, and basically that's something that we measure, and then that actually also answers the research question regarding to potential harmful effects of these interventions being assessed in RCTs. But clearly, it wouldn't come to that point wherein we perform RCTs if the harms of a new therapy far outweigh the benefits. Obviously not, no? So uh, in all cases, the benefits far outweigh the harms of the intervention or exposure, and we're just looking at harm as a secondary objective because it's unavoidable that that you cannot avoid it that certain new medications would have their adverse events. Okay, so this is what we would look into when we're addressing research questions pertaining to harm. Now, for a lot of research questions, the cross-sectional design can also be used. Okay, and then we very often make use of this particular format. So among population, what are the factors or exposures associated with the outcome of interest, or could be in this manner as well. So insert population here, is this particular factor or exposure associated with this particular outcome or not? So more often, if not always, you will end up doing cross-sectional studies as you advance higher in the MEDRES subject or the MEDRES program because of time constraints. So we only have a certain amount for data collection that cohort studies are just not feasible to do. Okay. Okay, so as a review, so cross-sectional studies measure both exposure and outcome at the same time in one point in time. So it's basically a snapshot uh, of what the status is or what the prevalence is of the exposure and what the prevalence is of the disease or outcome among the study population that you're involved with. Okay. Now, obviously, when you compare this or contrast this with cohort studies, there are obvious limitations to the cross-sectional design. So the obvious problem with cross-sectional designs is the problem of temporal ambiguity. So what does this mean? So I think it can be exemplified in this particular image here. So we're not really sure which occurred first. Was it the exposure that occurred first that affected the outcome, or is it the other way around? Okay. So this actually threatens the validity of your study. So whenever you're designing, whenever you are going to embark on research projects that will make use of cross-sectional study design, so you really have to be quite elegant and intricate, and be very familiar with the background of the study, in that the exposure of interest uh, is highly likely to be occurring prior to the outcome of interest. Okay, so that again, we stress the importance of a thorough literature review. Okay, now I'm going to give a few examples that previous MEDRES 1 students came up with using the format that I gave a couple of slides back pertaining to associations between variables. So I actually included the format here in gray color, as you can see. Okay, so the first example is among first-year medical students at San Beda University College of Medicine enrolled during academic year 2020-2021, is there an association between learning style, which is measured using the VARC questionnaire, and long exam scores for the metabolism module of biochemistry? Okay, so that actually has pretty much all of the components of the PECOM model. Okay, so here's another example. So among first to third year medical students enrolled at San Beda University College of Medicine enrolled during academic year 2018-2019, what are different factors affecting their classroom attendance? So in this particular example, they want to find out, or they're trying to find out from scratch what are the different independent variables, or what are different exposure variables or factors independently affecting the outcome, which is classroom attendance. Okay, and they also defined the population and the time frame or the time period, or which is reflected by the academic year. And here we have another example. So among young Filipino individuals, so and by that their co-medical students, among their classmates of medical students, can BMI computed using a proposed formula that's by an Oxford University professor by the name of Nick Dracaten. So he proposed this formula for BMI, and basically what these students wanted to find out was, can BMI computed using this formula predict body fat percentage, which they measured using a body impedance machine, better than BMI computed using the traditional Ketilet formula, okay, the weight in kilogram over height in meters squared. Okay. Okay, so I think you've already seen this image before in previous MEDRES 1 lectures. So as a review, so the RCTs occupy a higher position in the hierarchy of study designs. So as you go higher up in this pyramid, the quality of evidence when it comes to causality improves. Okay, so the higher you are in this pyramid, the more certain you are, in simplest terms, that the exposure of interest is causing the outcome. Okay? So let's now move on to the second part of this lecture, which would involve construction of conceptual frameworks. Okay, so let me start off this section by defining what conceptual frameworks are. So, a conceptual framework represents the researcher's synthesis of literature on how to explain the phenomenon he or she is investigating. Now, to put it differently, a conceptual framework basically contains the different study variables that you have in your study, and you arrange them in such a way that you show how each of the study variables relate to each other. Okay, so I'll be giving you the basic format or the basic arrangement of a conceptual framework, which I highly suggest that you just stick to at your level as MEDRES 1 students for the time being. Okay, basically, the main components of your conceptual framework should include your independent and dependent variables. So, independent variable is sometimes termed as the exposure variable, which is hypothesized to lead to or cause the dependent variable, which is sometimes termed as the outcome variable. And whenever possible, we also include what we call intermediate variables, which goes in between independent dependent variables in the same pathway. Okay, and you should also include what we call confounding variables. Okay, so I'll be quickly defining what confounding variables are in a bit. Okay, but it's always important to mention or to know or to show what your confounding variables are, because these variables could potentially distort the relationship between your independent and dependent variables. And sometimes confounding variables can actually have a mediating or can actually have a certain type of effect. We call that effect modification. Okay, wherein different levels of that third variable would actually result in different relationships between independent and dependent variables. So I'm not going to dwell much on effect measure modifiers, but it's something that we can definitely revisit during your SGDs once you're already discussing your specific research questions and research topics. Okay, so I'll be presenting here the basic format of the conceptual framework. Now, as I mentioned earlier, let's try to keep things simple as far as your MEDRES 1 project or the MEDRES 1 course is concerned. So let's just limit ourselves to the basic components of your conceptual framework. So we have here our exposure or independent variable and the outcome or the dependent variable. And this is what we are hypothesizing, that the exposure is associated with the outcome or the exposure is leading to the outcome. Now, we also have to take into consideration extraneous variables which can independently cause or affect the exposure and at the same time the outcome as well. Okay, you call these confounders. I'll be going to a bit more detail later in the next slide. But why is this important? We have to identify our confounders and to control for them, because if we leave them uncontrolled or we did not account for their effects in the analysis, this could actually potentially distort the association between exposure and outcome. Now, one very common occurrence would be when we measure crudely the association between exposure and outcome, we see that there is an association. There's a positive association, meaning that the more of the exposure there is, the higher the chance of the outcome. But after we account for the confounders in the analysis, we see eventually that the what was the apparent association initially observed between the exposure and outcome is now absent, which tells us that the what we thought was initially the relationship between the exposure and outcome is more the effect that the confounder has on the exposure and at the same time on the outcome. So we really have to control for them, and there are statistical measures that can be performed to control for your confounders. Now, it is your responsibility as MEDRES 1 students to identify what your confounders are. Okay, so and again, it all depends on the research question that you are going to come up with. Okay. Okay, just to quickly reiterate, so confounding variables are also termed third variables, or sometimes they're called extraneous variables. Now, the requirements for a variable to be a confounding variable would be that, number one, it independently influences the exposure, or your independent variable. Number two, it also independently influences your outcome, which is also your dependent variable. Okay, and I think I've already mentioned this quite enough in the previous slide. If you do not control for such effects, it will actually result in a spurious or biased relationship between your exposure and outcome. Okay. Now, maybe at this point it might still seem rather abstract to you, but hopefully once we go deeper into your research question, research projects, we could be able to tease all the details out and it becomes easier for you to understand. Okay, so pay close attention whenever you're in your SGDs in the future. Okay. Okay, so let's have an example first. So let's say you've already constructed your research question, and that research question is what is the effect among a certain population of patients? What is the effect of alcohol consumption on mortality? Okay, and basically, once you start constructing your conceptual framework, you've identified your alcohol consumption as your independent variable, which you hypothesize is affecting mortality, which is your dependent variable. And after you initially collected your data and then you've computed for the crude relationship between alcohol consumption and mortality, you see that there's a positive association between the two, meaning the more somebody consumes alcohol, the higher the risk of that patient to die after a certain number of years. But you also identified and measured a bunch of other variables, namely age, sex, ethnicity, education, diet, exercise, smoking, adiposity reflected by your BMI. And as you can see here, each can independently affect your exposure and affect your outcome at the same time. Now, let's just say hypothetically that you included these variables in the analysis. You controlled them in the analysis. What you initially observed as a positive relationship between alcohol consumption and mortality, after controlling for the effects of these confounders, could be that the association now disappears. That's one possibility. Or maybe another possibility is that the relationship between alcohol consumption and mortality, after controlling for the confounders mentioned, would actually strengthen or increase the association. So we don't know. But hopefully you see my point that there are many variables that are affecting each other at the same time. So it's really just a matter of identifying them. Are they plausible confounders? And if so, how can we measure them and how can we incorporate them in the analysis afterwards? Okay. Now, it's also possible that your research question might involve a set of different exposures which you are hypothesizing to simultaneously affect a single outcome. So that is also valid, and that's also something that we can work on uh, at your level as MEDRES 1 students. So if that would be the case, we have here on the left side the set of exposure variables that are putatively affecting the outcome. And then we have the outcome on the right side of this image. And you can see here the direction of the arrows. So it's from left to right, implying that these factors on the left are hypothesized to affect the outcome, which is on the right, simultaneously. Okay, so there's actually another this type of conceptual framework is also acceptable. But again, I reiterate that this is up for discussion with whoever your preceptor would be when it comes to the SGDs in this course. Okay. Okay, so this is yet another example of a conceptual framework. So you have your exposure variable being patient-centered medical home, and then the outcome being child development, child prevention, so whatever that means. But basically, you have an exposure and you have an outcome. And you can see here that you also have the confounders laid out for you, and we actually have a moderator as well. So the moderator here seems to seems to function as the effect measure modifier. So we want to look at the different levels of this modifier to see if the relationship between your exposure and your outcome would be different depending on the levels of that effect modifier. Okay, so this type of framework is still acceptable. Okay, it's still doable. It's still simpler when it comes to analysis. So if there's anything, if anything, don't as much as possible, don't make your conceptual frameworks more complicated than this. So this basically has the basic components. Let's just stick to that for our sake. Okay. Now, of course, there's no stopping you in constructing more intricate and more complicated conceptual frameworks. But word to the wise, again, I stress sticking to the basic structure because the statistical analysis for this becomes much more complicated, and given that you have limited time in medical school because you have your other basic subjects to worry about, I suggest to keep things simple. Just stick to the basic components, or stick to the basic format of your conceptual framework. Okay, now before I leave this section, I should just point out the importance of defining your variables, more specifically, operationally defining your variables, right? Because this makes it much easier for you once you start collecting your data and once you start analyzing your data. Okay, so first and foremost, I need you to understand the difference between what we call the conceptual definition and the operational definition. So basically, conceptual definitions are the ones that you see in the dictionaries. Okay, so they use literal terms to specify the qualities of that particular variable. However, when it comes to research, this may not actually be that useful to you as opposed to operational definitions. With operational definitions, we are basically giving you, the researcher, instructions on how to measure that particular variable. Okay? So with operational definition, we are not concerning ourselves with the concept of that particular variable, but rather how can we measure that variable quantitatively. Okay? Okay, so allow me to give you a few examples here. So we have here three concepts, or rather three variables, namely the variable love, the variable aggression, and the variable self-esteem. Now, if you would just include the conceptual definition in your drafted manuscripts or drafted proposals, it's not really going to be that helpful for you because conceptual definitions, on the most part, do not give you any instructions on how to measure these variables that you've listed down. Now, let's just take the variable love, for instance. So the conceptual definition of love would be a feeling of intense positive emotion toward another individual, a desire to be with and protect that person. That's all good and well to have this definition, but does it give you any idea on how to measure love? So clearly not. So we have to devise a way in which we could be able to measure love. So that for that, we have to come up with a good operational definition. Now, again, this is just an example. So let's just say love would be defined operationally as the number of times somebody glances towards their loved one. So, and then we have to also qualify that the glances are glances of affection. Okay, so the number of we're just going to define, for instance, love as the number of times somebody glances towards their loved one. So that being said, the more somebody glances towards their loved one, the higher the magnitude of love would be. So again, that's just an example. It's just to bring across the point that we have to operationalize our variables to make it more convenient for us to measure them. Now, how about aggression? So, aggression is conceptually defined as the behavior that is intended to injure someone physically or psychologically. Now, again, it does not tell us or does not give us information on how to measure aggression. Now, again, this is just an example, but in this case, we operationally define aggression as the intensity of shock someone supposedly gives to a partner. And there are ways in which you could be able to quantify shock or emotional shock that that somebody is experiencing. You actually do have validated questionnaires for that. Okay. Now, how about self-esteem? So, self-esteem is defined conceptually as the degree to which someone feels that they are worthwhile. Now, again, we don't have any information on how to measure that quantitatively. So in such case, or rather in this case, again, this is just an example. So it was operational defined as the answers to questions of a well-designed self-esteem questionnaire. So there are many of them. There are many of them that are validated. So you could actually make use of that and incorporate the use of such questionnaires in your operational definition of variables. So that is actually allowed. Okay, so hopefully, well, I'll actually be giving a few more examples in the next slide, and after this, hopefully, you could be able to now distinguish distinguish between conceptual and operational definition. The latter being what is more important to us in medical research, right? Okay, so here are a few more examples. This time around, they're not as abstract as the three examples that I gave in the previous slide. So we have here weight, age, hemoglobin level, and BMI. And believe it or not, even though these are more concrete, they still have conceptual definitions, which may or may not be helpful to us in terms of how to measure them. Okay, so let's take weight for instance. The conceptual definition that was given here was the heaviness of an object. But how can we quantify that? So operationally, we define weight as the heaviness measured in kilograms, as measured, I mean, just to add on more to that, as measured by a weighing scale, right? So hopefully you can now see the difference between conceptual and operational definitions. Now, how about age? So age is conceptually defined as the amount of time being during which a person has lived. But again, you have to quantify this once you start collecting your data in your actual research. So you actually have to have a more detailed definition that would give you a more accurate measurement of what age is. Okay, so age now is defined as the length of time from birth measured in months or age in years at last birthday. Okay, so that would be the age that you would use and record in your source documents for the age of that patient. Okay, or the age of that study participant. Okay. Now, how about hemoglobin level? So hemoglobin is conceptually defined as the level of red protein responsible for transporting oxygen in the blood of vertebrates. But again, just to reiterate, operational definitions are definitions that would help us measure this variable. So in such case, or in this case rather, the operational definition that we will go for now for hemoglobin would be the concentration of said protein in capillary blood measured in milligrams per deciliter as measured by a hemoglobinometer. All right. And lastly, we have BMI. So BMI is conceptually defined as a measure for human body shape based on an individual's mass and height. But as far as research is concerned, we have to quantify them. So we just go ahead and operationally define BMI as the weight in kilograms divided by the square of height in meters. So at least that gives you something that is quantitative. Okay. So hopefully it's now much clearer what the difference is between conceptual definition and operational definition. And again, just to reiterate the fact that it is, or it are the operational definitions that we make use of in our protocols or in our research. Okay. Okay, so the third and last part of this video lecture would be on formulating objectives. Okay, so objectives basically are the goals, or they embody the goals of your research project or your study. Okay, so your objectives should emerge from your research questions or hypothesis, and they have to be consistent with the conceptual framework that you constructed. Okay, and furthermore, objectives should help you to focus the study and to avoid the collection of any unnecessary data. And that way you could be able to organize the research in clear and distinct stages, right? Now, in order for your research objectives to be able to do just that, they have to be formulated the SMART way, okay? SMART is a mnemonic that stands for specific, measurable, achievable, relevant, and time-bound, right? And they also have to be phrased to clearly meet the purpose of your research, and they have to be related to what the specific research is intended to accomplish, okay? Okay, now in order for your research objectives to be good research objectives, they have to be stated as action verbs that illustrate the purpose of your study. So very common verbs or action verbs used are determine, compare, verify, identify, calculate, reduce, describe. They basically talk about something concrete. Okay. Now, for that matter, you should by all means avoid using vague non-action verbs such as to appreciate, to understand, to explore, to know. These types of verbs, non-action verbs, don't describe anything concrete or don't describe anything goal-oriented. Okay, so hopefully you could be able to see the difference, right? And additionally, you have to phrase your objectives clearly, unambiguously, and specifically, and they have to be stated in measurable and operational terms. So I've already been talking about operational definition of variables previously, so it's here that we try to incorporate those concepts. Now, when you draft your research proposals, you have to mention what your general objective is as well as your specific objectives. So let's start off first with the general objective. So basically, it is a single statement that identifies in general terms what is to be accomplished by your study. It states what your research ultimately wants to achieve, and it should specify what kind of knowledge the study is expected to obtain. And lastly, it should provide the answer to your research question. Now, as opposed to your general objective, which is just a single statement, you have a set of corresponding specific objectives, which identify in specific details by using measurable parameters at that, how we will accomplish the research. And by specific details, we are pertaining to the components of the PCOM-PECOM model. We will have a few examples of this in a bit, okay? Now, think of specific objectives as step-by-step instructions that provide you details that ultimately lead to the achievement of the general objective, okay? Now again, let's not make our lives too complicated. We limit our specific objectives to less than 5, okay? So 3 to 4 should suffice, provided they have sufficient details on what needs to be achieved during the course of your research or your study, okay? Now, the important thing with specific objectives is that you should use terms that are measurable. And by that, it's in terms of risk, odds, prevalence, incidence, or proportions. Depends on what you would like to measure, okay? Now, oftentimes, you'll have to enumerate them, starting first with how you will ascertain your independent variable, and then your dependent variable. Then how will you determine your covariates or confounders, and how are you going to test the association between your independent dependent variables, and at the same time relating all the other covariates or variables together and controlling for their effects, all to achieve your general objective. Now, hopefully, you will have some time allotted during your SGDs on constructing your general and specific objectives for your research proposal. Okay. Now, as you can see here, there appears to be a general format that you can use to formulate your general objective. And if you would look closely, it would contain the different components of your PCOM-PECOM. Okay, so let me just read the first bullet here, or the first example. The first example would be to determine the efficacy of, then you state that treatment or intervention as an adjunct in the treatment of, and then you insert the name of the disease among, then you identify the population in, and you state what locality it is that you're working in and what the time period is, okay? And this would be another example of a well constructed general objective. So to identify the behavioral factors, so in this case we're interested in multiple factors independently affecting a single outcome. Okay, so to identify the behavioral factors associated with leptospirosis seroconversion, and then you have to state the location or your study site, and from what time point to what time point. Okay. Okay, so here's another example. This time I've placed both general and specific objectives in a single slide. Okay, so the general objective reads to estimate the mean difference in test scores on topic X between flipped classroom versus traditional lecturing among freshman students enrolled in course Y at University Z for academic year 2021-2022. Okay, so that would be the main goal of the study. Now, in order to get to that main goal, the researchers have to follow a step-by-step process wherein they ascertain their different variables. Okay, so first they had to ascertain and describe the different demographic variables of the students that they are involving in their study. Okay, so to describe the freshman students in terms of age, sex, socioeconomic status, college entrance exam scores, type of high school. Then afterwards, the next step that they have in their step-by-step process is to determine and compare the distribution of the aforementioned demographic characteristics between the flipped classroom and traditional lecture groups. And they mentioned using independent samples t-tests for means and proportions. Okay. Then afterwards, they wanted to analyze all of these variables together because they're anticipating that there might be some confounding, that the variables mentioned in specific objective 1 may have between test scores, which would be the outcome variable, and type or approach of teaching, which could either be flipped classroom or traditional lecture, which is the independent variable. Okay. Then lastly, they aim to determine the adjusted mean difference in test scores between the two teaching approaches after accounting for the effects of the different covariates that were mentioned in specific objective 1. So you can see there's a step-by-step process here, right? And then the last step ultimately leads to the achievement of the overall goal. Okay. Okay, so for the next several slides, I'll be giving not so good examples of research objectives for which we can all comment on. Again, the comments that I'll be giving here will not be that exhaustive, in that you may actually have comments of your own that I may not be mentioning during this remainder of the video lecture. Okay, so I can just take note of that, and then once you start formulating your objectives during one of your SGDs, you can be able to avoid such pitfalls. Okay, so let's start off with the first example. So to study diarrhea. So clearly, this objective really lacks in detail, and on top of that, or rather for starters, the verb that was used was a rather inappropriate one, in that it doesn't really imply anything measurable. Okay, so clearly there's so much detail that is lacking here that it's virtually a useless objective. Okay, so the next example, so to determine the role of infant feeding in diarrhea, so comparatively it has more detail than the first one, but it's still rather abstract, and it still needs more detail as to give the researcher instructions on how to go about measuring their variables, right? So for one thing, what role are we interested in here? Okay, so the role of infant feeding, is it in terms of uh, changing the incidence, or is it in terms of preventing? Well, we don't know. So that gap clearly needs to be filled in for this particular objective. So let's now see the third one. So to compare the incidence of diarrhea among bottle, breast, and mixed fed infants. So now there's much more detail here. The role that has been mentioned in the second appears to be pertaining to the incidence of diarrhea. And then this time around, the researcher has identified three groups of infants: solely bottle-fed infants, solely breastfed infants, and mixed-fed infants. And with that, they can measure it. They can go ahead and measure the incidence of diarrhea among these three groups, and then see if there's any difference. Okay, and maybe perhaps if we are to add a few more details to this particular objective, maybe we give an age limit to infants. Okay, maybe infants younger than 6 months of age and who are living in this locality, born to a certain type of demographic, and so on and so forth. So again, there's still so much that we can improve on this one. So it's basically it all goes down to what the researchers are interested in determining or doing. Okay. Okay, so here's another example. To determine the effect of iron supplementation among pregnant women. Okay, so again, it's lacking in detail, even though the correct action verb was used to determine, so that's appropriate. However, as I mentioned, there's not enough detail to go for or to go with in this particular objective. For one thing, what effect are we interested in? What effect are the researchers pertaining to? And maybe perhaps we also have to be more specific with pregnant women. Are we pertaining to pregnant women in their first trimester, or their second trimester, or their last trimester, or Is this for the whole duration of the pregnancy? So these are just a few things that we can actually add on, and perhaps you might have other thoughts that you can, other thoughts about which other details that can be included in this particular objective. So here we have a suggested version. So to compare the change in birth weight of babies whose mothers received iron supplementation during the first, second, and third trimesters of pregnancy. So now we already have details uh, as to what the effect of iron supplementation is. So in this case, changes in birth weight of babies is the measure of interest that reflects the effect of iron supplementation. And then we've also determined which specific trimesters of the pregnancy we're interested in. Okay. Okay. So let's have another example. To enhance barangay health workers' appreciation of primary health care training programs. So to start off, or rather to start with, the verb that was used was rather inappropriate in that it doesn't really, or it's rather vague and doesn't really imply anything measurable. Enhance doesn't really tell us much detail. Another thing, how appreciation will be measured in this case is rather unclear. Now, here we have a suggested version. To determine, again, we're making use of a more appropriate action verb. Okay, so to determine the percentage increase in attendance of barangay health workers, so the percentage increase in attendance would be reflective of their appreciation. Okay, so to determine the percentage increase in attendance of barangay health workers in primary healthcare training programs after an information drive. Okay, so basically the information drive here was the measure or the tactic that was used to enhance the appreciation of barangay health workers of primary health care training programs. Again, appreciation being reflective of appreciation reflected by the percentage increase in attendance. Okay. Okay, so let's look at the last example. To grasp the significance of the school health program. Again, not enough details, and there's also usage of an inappropriate verb for the objective. Then significance, what qualifies or what quantifies for significance? Okay, so and on top of that, there's what's called value judgment, wherein the researcher already assumes that the health program is significant when in fact we don't know yet how the effect would be, because we don't know how such school health program will be accepted by the faculty or the teachers in that said school and by the students themselves. Okay, so hopefully we can learn from all these bad examples, and once you start constructing your or formulating your objectives during one of the SGDs, you could be able to avoid these pitfalls and have a smoother course in terms of formulating your research objectives, right? Okay, now a few things you can do on your own. You can come up with your research question, and you try to determine under what type or category does your research question fall. Is it under therapy? Is it under diagnostics? Is it under prognosis or harm? Okay. You can also go ahead and construct your conceptual framework, identifying the different components of your PCOM-PECOM model. Okay, and you operationally define your different variables. Then afterwards, start formulating your general and specific objectives. Now, again, you can do this on your own, and maybe in preparation for a future SGD when you are tasked to do all of these. Okay, so I'll be ending my video lecture here, and hopefully you've learned something from it. And good luck with all your future endeavors under this MEDRES 1 course. So thank you very much.